Welcome, everyone. Thank you for joining us today as we discuss healthcare on your terms, communicating your values and wishes. My name is Yusimi Sobrino Bonilla, and I am a nurse practitioner and the clinical supervisor of the palliative care program for the Valley Health System. I will be moderating this evening's event. Just wanted to bring up some housekeeping items before we begin. Questions can be submitted through the Q&A section or in the chat, and there will be time at the end of the presentation to review and answer questions. If you have difficulty with the video, it is sometimes helpful to log off and log back in. We do appreciate your time today, and especially on a busy Wednesday evening, to chat about something that is very near and dear to us. And I want to get us started by introducing our speakers. Donna Gormley is a board-certified healthcare chaplain on staff at Valley Hospital. She has many years of training and experience providing care to those experiencing spiritual or emotional distress related to chronic or sudden illness, bereavement, or other significant life changes. Donna works with patients, their loved ones, and medical providers to promote well-being. She helps patients and their families identify what is important to them and facilitates alignment of medical care with these values. Donna also often assists in medical decision-making and family meeting. So we want to welcome Donna here today. And Dr. Ayelet Spitzer went to medical school at New York Institute of Technology, College of Medicine. She completed her residency at Queens Hospital Center and her fellowship at Memorial Sloan Kettering Cancer Center. She holds board certification in both internal medicine and hospice and palliative medicine with over 10 years of experience. Dr. Spitzer leads the outpatient palliative care program. She supports the hospital and home-based palliative care service and collaborates with Valley Hospice. I am happy to turn this over to Donna and Ayelet.
Thanks, Yusimi, and welcome everyone. I just want to, before we begin, I'd just like to go over some objectives for this evening's program. And the first one is to explore how and why to discuss your values and wishes with your loved ones. We'll also explore how and why to discuss your values and wishes relative to your healthcare plan with your medical team and loved ones. And then we'll explore other resources that can help you prepare for these discussions. And as Yusimi mentioned, we'll be happy to take your questions at the end of the program. I'm going to stop sharing for a moment. Okay, 1 sec. Get my notes up. Okay. Here we go. Oops, sorry. Okay.
Donna, we can hear you. You can.
Okay, thanks. Okay, here we are. Okay. So a lot of my work at the hospital involves supporting patients and their families who have serious progressive illnesses. And many of these people have lived for years with good medical care to manage their symptoms. And they've been able to continue to do all the things they love. Then comes a time when their symptoms are not so easily managed. They may have repeated hospitalizations and become frail. I often meet stressed and confused patients who are aware that they have a serious illness, but they never discuss what to expect with their medical team or their families. They hoped for the best, but they did not prepare for the rest. So when I meet them in the hospital, the patient and their loved ones are caught off guard about the medical decisions that they are asked to make. They never considered what was important to them should they become critical ill or at the end of their life. And sometimes these situations arrive unexpectedly. The problem is it's difficult and sometimes impossible to have those conversations when someone is critically ill. Patients and family members are sad, stressed, and confused about what the right thing to do might be. Often it robs patients and their loved ones of the opportunity for closure at the end of life, to take care of important things or to say important things to each other, like I love you, please forgive me, I forgive you, and thank you, or just to enjoy being together for one last time. So it's great that you're here tonight to start thinking and having conversations about what you would like for yourself. Perhaps you're here because you are concerned about how you might support a loved one as they face a serious illness or the aging process. Well, the first thing to consider is what is important to you in your life. What does a good day look like for you? What and who supports you through difficult times? Of course, these values may change over time, so it's important to keep reevaluating them. Sometimes people say they value being active and independent. They would never want to be bedridden for a long time or hooked up to machines long term if there was no potential for recovery. Others say they are content with a more simple lifestyle, say being able to read or watch TV. Some may say it's important for them to be at home with family. Some may have spiritual, religious, or cultural values that would influence their medical choices. Once you've thought about what's most important to you, find time to start a conversation with those closest to you. Though these conversations can feel difficult, even a little scary, it can be a priceless gift to let your family know your wishes. You may consider naming a healthcare proxy and alternates who would collaborate with your medical team to make decisions that are aligned with your values, if and only if you are not able to make decisions for yourself. If you don't have a documented healthcare proxy, the medical team will follow state surrogacy law for consulting your next of kin. It's a great idea to include your healthcare proxy and others closest to you in conversations with your doctors. If they can't make it to an appointment, they can always participate by telephone. Having an extra set of ears at your medical appointments can really help you understand your care plan, know what to expect, and get the care you want. You may want to write down your values and wishes in what's called an advance directive or a living will. Your doctor or medical provider can help you with this documentation, and we'll discuss some helpful resources in a little bit. Now, Ayala is going to speak more about how to have these important discussions with your medical providers. Ayala?
Hi, thank you all for coming tonight. When we receive serious news from our physicians, from our nurse practitioners, whoever our primary care provider is, a lot of us will become really overwhelmed. You know, in a routine visit, you can forget 30, 40, even 50% of the information and the recommendations as soon as you leave the office. And when we're talking about more difficult information, that number can be as high as 80%. And really, who can blame us? Most of us didn't go to medical school or nursing school, and we really don't understand the language that our medical team is speaking. Sometimes our physicians might see our distress, and instead of telling us what we need to know, they might tell us what we need to hear at the time. And we trust our physicians, we trust our teams to do what's best for us, so we really let them take the lead. But how can a doctor know what's best for us when we don't even know. I don't really want to spend too much time talking about the technical side, completing advanced directives, appointing a healthcare proxy, the different types of documentation that may help to convey your wishes to your family. But I do want to discuss how you might approach these conversations with your doctor and how to learn the information that can help you make those decisions. What I see a lot in the hospital, in the office, I see a lot of people with boilerplate advanced directives or living wills. Maybe they'll say something like, if I become permanently unconscious, or I'm in the terminal stage of an illness, I direct that all life-sustaining measures be withheld or withdrawn. And if you do have an advanced directive, you can check yours to see if it might say something like this. A lot of people don't really know what that means, and others don't even know what their advanced directives say. The number of times I've heard people tell me, well, I don't know what my advanced directive says, my lawyer has it, or it's in the bank, it's in the safety deposit box. These documents are designed to give people information to help you. And it's hard to know what you would want if you can't even locate the documentation that might say it. I would also say family members don't know where these documents are, and that's another very important thing to do. Make sure your family member has a copy. Legally, an advanced directive will appoint a healthcare proxy, and then the rest of it is giving your decision maker a broad picture of what you might want. There is no possible way to address every single thing that might happen to you. So it's important to think about what's important to us. And like what Donna said, is it being home, reading a book, being able to speak to your family, going to a grandchild's graduation, living for as long as you can? All of these are really, anything can be important to you. So how do we get the information to ensure that the treatments we receive will get us to these goals? So I just want to talk a little bit about how you can talk to your doctors and what questions you can ask and what information you need. Before a visit starts, or in the hospital if you're having a family meeting, see if you can have someone join you, a family member, a friend, someone you trust. Even if you forget what you're told, someone else might be able to remember more details or write things down that may be important later. Just as an aside, it's so easy to record things nowadays. You just, the app is built into the phone. You just press record. But a lot of hospitals and physicians' offices have policies that prohibit this, so always ask before you hit record. While at the office, listen to what your doctor has to say. But ask. Ask your doctor about your diagnosis. What can you expect over the course of your illness? What do most patients experience? What are some of the more severe symptoms or complications to look out for? Is your illness chronic, progressive, life-limiting? What does that even mean? Your doctor may not give you numbers or percentages, but they should be able to answer these questions. As far as treatments go, ask about success rates, but don't forget that success might mean different things to different people. For your doctor, a successful procedure, let's say a hip replacement, might mean that the patient tolerated it and was discharged without any complications. To the person having the hip replacement, it might mean they'll be able to walk within 3 months without pain, like they could 5 years ago. So make sure your physician understands what's important to you, what success means to you, so they can offer you the interventions that give you the best chance of getting to that goal. The other thing you should ask about is what the treatments mean and what they entail. Will you need a surgery to have a port placed? Will you need to take a medication 3 or 4 times a day? Talk about which treatments are reasonable. The treatments that offer a reasonable chance of a reversal of a specific illness. Is resuscitation or intubation? It may seem reasonable at first. Everybody wants to do everything and give themselves the best shot. But in the setting of specific illnesses, they may not be appropriate. With respect to intubation and resuscitation, that's when they put people on a ventilator and they do CPR and chest compressions. CPR may be able to restart your heart, and that's what we consider successful CPR in the hospital, but it might not get you back to the quality of life that you consider acceptable. You should also ask about side effects that patients experience with treatment. What are the most common side effects? Which are most severe? How would we manage those side effects? Will they improve if the treatment is stopped? It may seem like a lot of questions to ask, but some of them you'll hear the answers naturally over the course of your conversations. I would also say take notes, ask questions, write your questions down ahead of time or in between visits. That helps you retain more information, and it'll help you understand it better after the doctor leaves the room. I very much appreciate it when families come with questions. That way I can make sure that I'm addressing what I want to tell them, but I also hear what they have to say, and I learn what's important to them. On average, doctors are terrible at listening, right? We interrupt patients pretty much right away. I think the latest number I saw was 11 seconds we listen to patients. And a lot of times sitting in that patient chair, even I know from myself, we don't push back and we don't understand a lot of what we're hearing. And we assume that the doctor understands more than what we're telling them and that they're telling us all the important information. It's not intentional. We're all human, and sometimes we don't communicate well with each other. It's just important to make sure that you convey what it is you're thinking. Lastly, it's normal and natural for your wishes to change. Your health changes, and with that, your goals might change. What's best for you today might not be what was best for you 5 years ago, or what will be the best for you in the future. What qualifies as good quality today might change, and what treatments you feel you'll accept may change as well. You are not a static being, so it's okay for your priorities to change. Whatever happens, just make sure the lines of communication with your physician are open, and make sure to tell your physician what your goals are. This helps them formulate a treatment plan that can help you best. I'm going to pass it back over to Donna.
Yes. Can you hear me?
I can hear you.
Okay, good. Thank you. Sorry, I have so many things open. So thanks for bearing with us. So thanks, Ayelet. I'd just like to, as we said before, share some additional resources. We've shared a lot of information this evening, and I know you probably have a lot of questions, and there's a lot of details that you may want to know about. So I want to show you quickly where you can find more information. And I'm going to ask Sue, who's working behind the scene, if you can put the link in the chat box to some additional information that we can get on the Valley Health website. So I'm going to I've shared my screen. I'm going to just show you where this information is on control click. I'm going to take you to the Valley website. Here we go. So this is the advanced care planning section on the Valley Health System website. I just want to show you how you might get to it if you go to the homepage of the Valley Health System website. For those of you that might not be so tech savvy, there's always a little like magnifying glass section. That's the search bar. And so just click open the search bar, and you're going to type in advanced, try again, care planning, and hit enter. And then you'll see the search results will take you to the advanced care planning page. And this is actually part of the Valley Cares section of our website that has a whole host of different resources that you might want to explore. You can spend a whole week just going through all these resources. But today we're just going to talk about the advanced care planning section. And you can see there's 3 sections here, and these little plus signs allow you to open additional information. So the 3 sections are advanced directives, palliative care, and hospice. And we'll talk about each of those briefly. So I'm going to open the advanced directive tabs, and here it will actually allow you to download Valley Hospital's advanced directive form, both in English and Spanish. So if you click on the link, it'll give you just a standard advanced directive form with some initial instructions. And then a place that you can actually fill this out yourself. And just one thing that sometimes people get confused of, the signature on the advanced directive is actually the signature of the patient, the person seeking care. It's not the signature of the healthcare proxy. But this allows you to designate some healthcare proxies and alternates, and give some information. And again, they're kind of boilerplate, like Ayala explained here, but it does give you some additional information, additional space to add instructions there. So that's there. And again, you don't have to have an attorney. It just needs to be witnessed by 2 people. Or you can have it notarized. So that's there for you. What else is here? There's all these other websites you can go to learn more about advanced care planning. Some wonderful websites about having conversations with your family. One's the Conversation Project, Conversations of a Lifetime. There's information about a post form, which is something that you would fill out with your medical provider, all kinds of legal services, all kinds of other things. Ayala, would you like to point out anything else in this section while we're here?
Oh, sorry. I think a lot of what's here is very helpful. The conversation project, I know Donna spoke about it. These help to guide conversations. 5 Wishes, Aging with Dignity, is a more specific form of an advanced directive. Something else that I tell people is that these resources can help you to have the conversation, but more important than having it, putting it down on paper and putting it somewhere, is making sure the people who are going to be making those decisions for you, if you can't make them, know what's important to you. Because that's the only way they're going to be able to make decisions that aren't specifically enumerated in the advanced directive.
Okay, thank you. And as Ayala mentioned before, those situations can change over time. So it really needs to be something that you continually discuss with your loved ones and your medical team. So I just want to speak briefly about these 2 other items, palliative care and hospice. You may have heard those terms before, and I just want to tell you what they are. So palliative care is really specialized care for people with serious illness, and it can be given alongside disease treatment for your diseases. And it's an extra layer support, and palliative care providers specialize in aligning your values and wishes with your goals of care. And they also specialize in symptom management. So the idea of palliative care is to have that extra layer of support if you're living with a serious illness so that you can have the best quality of life. And again, you can have that along with disease directed treatment, and you can have that in the beginning of your as soon as you're diagnosed, and it has nothing to do with end of life per se. I'm going to open this tab up to show you what's there. Oops. Why isn't my own getting this? Oh, here we go. And you'll see there's a couple of things here, one of which is Valley Health System Palliative Care Services, and we'll click on that, and you'll see the phone number of Valley Palliative Care. And again, as you see, palliative care is offered at Valley inpatient, outpatient, and in-home palliative care. And I'm going to allow Ayala to add a few more words about this.
So the services I think a lot of people, when they hear about the services, palliative care, that word can be a little frightening because it's natural that we really just don't want to talk about these things. We want to talk about enjoying ourselves now. So I will just say that one of the things when a palliative care consult is called, ask questions, but don't think of it as the end of the road. We're really just there for support. In the home, we have a nurse practitioner who goes out. She does symptom management. She does these discussions. She really spends time with you in your home to see how you can best be helped by your medical team and by our service. In the outpatient setting, we have appointments available, and it's just like any other doctor. You come into the office, we have a conversation, there's an exam, and it's not a scary thing to really go through. I think something that I hear a lot is, people were scared when they came to my office, but then they leave feeling a little bit better. And in the inpatient setting, we're there just to help support you. We'll listen, we'll talk. We have, wonderful chaplains who work with us, wonderful social workers, other services. And a lot of times you can become overwhelmed in the hospital. People are coming in 15 times a day. You don't get any time to sleep. We're really just there to give you a little bit more help navigating your illness. So Valley was very fortunate that we have such a well-supported palliative care system. So take advantage of it. Don't feel that you need to kind of worry about the words. Just listen for the service.
Thank you. Now I'd like to talk about the last service on this list, which is hospice. And hospice is both a service and a philosophy of care. It's a service covered by most health insurance and Medicare, and it's an extra layer of support for people at the end of their life. And to qualify for hospice, one would have to have a life expectancy of about 6 months or less. Doesn't mean that they have an expiration. We never give anybody an expiration. And ironically, people who enter hospice early on tend to live longer, better lives. And often sometimes people graduate from hospice and they get kicked off of hospice because they do so well. And, statistics show people who enter hospice earlier actually have longer life expectancies and do better because it's another layer of support. And really the time to consider hospice is when, there are no other disease-directed therapies available. So why wouldn't you then want all the support you can get to live your best life? So that's something else to consider as if you have a disease that has progressed, and to just anticipate that's the service that you'll be eligible for. And that can be of help to yourself, to your family and loved ones, and give you the best care possible. So here again, we'll open this up and there's more information. Other agencies that can give you other information. And of course, Valley Healthcare also has a hospice team that works inpatient and at home and in facilities. So this is information about the hospice care that Valley Health System provides. Ayelet, would you like to add anything here?
Yeah, so our hospice team, the nurses on hospice, the type of people who become hospice nurses are really special people. And they truly do care for their patients. They really do everything they can to give you support, to give you, to help with symptom management. And I think one of the things that people worry about is like kind of what Donna said, but the life expectancy is 6 months. What happens next? What if I get to 6 months and I'm still doing okay? No one's going to kick you off of hospice if you still need the services. You can stay on. I've had people stay on for a year, 2 years. It's not common, but people do stay on for longer. The other thing about hospice, I think that people don't usually know is most hospice is provided in the home. People kind of think of hospice as this building, like you go to a hospice and that's where you stay. And people kind of just, give you medication and sedate you, but that's not really what it is at all. It's an opportunity for you to be in your home, surrounded by your loved ones, and basically live as well as you can for as long as you can. So that's really how hospice can be helpful when you either choose or there are no more disease directed treatments available for you.
Great. Okay, I think I'll stop my screen share now, and we'll see if anybody has any questions.
So I appreciate the talk. I think this was great. I did want to give people a minute because the chat I see was disabled, so all of the questions are coming in through Q&A, and I wanted to give everybody a second or two to ask questions. There was one question, and I had to go back to the advance directive. Can anyone sign or be a witness for the advance directive?
That's a really great question. Anyone who is over the age of 18 and not the healthcare proxy can really sign an advance directive. Healthcare proxies have to be over the age of 18 as well, but if you don't need to go and have something notarized as long as you have two people who are not listed as healthcare proxies who can witness it.
Thank you. Another question came up about the home palliative care services and what they provide.
Yeah, that's a question that we have a lot. We get that question pretty often from our patients. So it's almost like the doctor is coming to you instead of you going to the doctor's office. So what I mean by that is our nurse practitioner will come out to your home, take a history, check your medications, do an exam. If it's necessary, she can prescribe medications or talk to your doctor to talk about prescribing medications. And then she goes and she comes back maybe 2 weeks, 4 weeks, 6 weeks later. We also have a social worker associated with our service who can come out and give you support from a social worker's point of view. She'll talk to you about what you're going through, what you're feeling. I think one of the things that we get a lot of the time is, do you provide wound care? Do you provide a nurse who will come and help me in the home? And unfortunately, those are not services that we provide. We're there to give you palliative care services in your home. We can help, if you need a hospital bed, we can help you order one. We can write a prescription for that, but we are not going to do your wound care. We don't have someone who comes and helps someone take a shower or get clean. But you do get the benefit of having the palliative care service in your home.
Thank you. There is another question. Are you saying that as the healthcare proxy, someone would need to present the document in the hospital or facility or even in the home setting?
That's a great question. I think what you're asking is, do you have to prove that you're the healthcare proxy? And if you don't have that documentation, then what happens? If I'm wrong, please ask again. The healthcare proxy, listen, it's always great to be able to provide a copy of the advance directive. In New Jersey and in all states, there's a surrogacy law that if someone did not appoint a healthcare proxy, or if someone can't provide the documentation, there's a hierarchy and there's an order that we go in. So, first we'll look to the spouse and then we'll look to the children. And, that's the order that we speak to people about a person's wishes. So is it 100% necessary to have an advance directive and to provide it? No, it can be very, very helpful, but it's not like people aren't going to be able to make decisions for you if you can't make them for yourself, if you don't have the documentation. I'm not sure, was that the question that the person was asking?
A follow-up was that as well as when making decisions. So just to kind of answer that a little bit, whenever someone comes into a hospital or doctor setting, we always ask if there's an advance directive, because it is helpful also for the medical team to be able to see what those wishes are and who we should be speaking to. There are many people who, as Ayelet mentioned during the talk, they have it in their lawyer's office, they don't have it with them, but we will always make an attempt to get a copy. It is a document that needs to be looked at and reviewed and see if what's in there applies to the current situation. So it's not something that we use in an emergency, right? So in the home setting, if you call 911, many of your paramedics will not look at the advance directive because they need to, it's an emergency. There is a different form, and maybe Ayelet, you could speak about the post, that is a medical order that can be used. So maybe if you give a little bit of a
Yeah, the post, it stands for Practitioner Order for Life-Sustaining Treatment. We call it the green form because it's green. And the reason it's green, I'm just going to say, if your copy is not green, it's okay. The reason it's green is so you can find it in a pile of white papers. It stands out. So the post form, what that does is it takes the advance directive, the conversation that you had with your family and your loved ones, and it puts it into a medical order. So for example, if you don't want to be kept on life support, you would then choose the section, in one of the sections, you would choose that you don't want to be put on life support. It also allows you to think about how aggressive you want medical care to be. And the way this is different than an advance directive is this in itself is an order. This is something that you can take with you, that you can keep in your house, and paramedics will honor it. You can take it to hospitals, you can take it to facilities, and anywhere in the state of New Jersey, this is a form that can convey your wishes in a medical order.
Yeah. Let me add, it's particularly important to have at home if If you choose that you don't want to be resuscitated if your heart should stop, or you don't want to be intubated, because if you don't have a pulsed form or a MOLST form in New York, the paramedic, and you call 911, the paramedics are legally obliged to perform CPR and intubate you.
So there are two questions. Who reviews the document? I'm saying the advanced directive. And are you recommending the POLST as well as the advanced directive? And these are some great questions, by the way.
Yeah, so when you are in the hospital, if the advanced directive, it would be great, you know, your primary care doctor is the one who has the relationship with you, pretty much. He's the person you go to, or she's the person you go to. They're the person who coordinate all of your care. So it's great for that person to have a copy of your advanced directive so that they know what they should talk to you about, what they should offer you as far as treatments. In the hospital, I know most of the hospitalists will look at advanced directives. The critical care doctors will as well. Palliative care doctors and nurse practitioners, we all look at these documents, and you know, sometimes we'll even print it out and read it to you. And we'll say, hey, look, this is what it says on your advanced directive, on your mother's, your father's advanced directive. And we want to make sure, first of all, that it's understood, but also if something is different than what is written in the advanced directive, we need to know that as well. As far as the POLST form, as recommending the POLST form as well as the advanced directive, they are different documents and they serve different purposes at different stages in life. If somebody has a terminal illness and they're not expected to do well, or they're in the hospital over and you know, they come to the hospital, they're admitted a number of times, the POLST can be helpful, a little bit more helpful than the advanced directive might be, because if something happens to you in the home, we know what to do. Do I recommend that a 35-year-old has an advanced directive? Absolutely, yes. Everyone should have an advanced directive. Do I recommend that the 35-year-old has a POLST? Usually not. I don't know if that clarified that question.
Unless the 35-year-old has a serious illness.
Of course, unless the 35-year-old has a serious illness.
Okay. I am not seeing any other questions.
One more point I just want to get back to about the question about, I think, who should have your advanced directive and healthcare proxy form. Give those forms to your healthcare proxy, right? Give a copy to them. This way, if they need to use it, they can. Lots of times your healthcare proxy may be your next of kin, but not always. And those are particularly important times that your healthcare proxy needs to have their copy. You know, we're Valley Hospitals in New Jersey, but I've worked in New York State. New York State surrogacy law is different. In New York State, if your children are making decisions, all your children need to be in agreement on your health care. So the surrogacy laws vary by state. So it's important to, you know, be aware of that.
Okay, I have about one. We have time for one more last question, and that is, do you need an attorney or a witness for the POLST form?
Oh, that's such a great question. You don't. Actually, you need someone with a New Jersey medical nurse practitioner or PA license. It has to be a medical provider who does the POLST for you. A lot of people will take these to their attorneys and say, hey, the doctor gave me this form, what do I do with it? But ultimately, you don't need an attorney, actually, for any of these forms. You need witnesses, but you don't need an attorney. So that's something I think that a lot of people get confused about.
Thank you. Time is up. It's 5:45. I want to thank everybody. This was very engaging. I hope that it provided you with information as to how to start some of these difficult conversations, or at least starting to think about what would matter most for you and how you would even broach these topics with families or loved ones and your medical team. Please feel free to reach out to us if you have any questions or concerns. Our phone number is on the palliative care page. And I want to thank all the panelists for joining us this evening. I hope everybody has a great night.